Hi, my name is Andrew Kuykendall. I am an assistant member in the Department of Malignant Hematology at Moffitt Cancer Center. And at AACR this year, we'll be presenting a trial in progress, which is a very interesting trial, which is a two-part phase 2 study of a drug called itacitinib in patients with primary or secondary myelofibrosis who've received prior JAK inhibitor therapy with either ruxolitinib or fedratinib. And so as a brief background, myelofibrosis is a myeloproliferative neoplasm that's marked by an overproduction of myeloid cells, abnormal cytokine production, aberrant kinase signaling. And typical approach to patients with myelofibrosis is we use drugs called JAK inhibitors, two of which are approved right now, ruxolitinib and fedratinib. And these drugs are really good at reducing spleen size, improving disease-related symptoms, but they're not great for everyone. And oftentimes they will actually worsen hematologic parameters, such as cause worsening anemia, lower platelet counts, and not everyone's eligible to receive these. And so we're looking at an agent called itacitinib, which is also a JAK inhibitor, but is actually more of a JAK1 than a JAK2 inhibitor. And this is a drug that's been looked at previously and really showed that it really improved symptoms in myelofibrosis patients, but didn't do a lot for spleen. And so that was the sustained release version, but this immediate release version is thought to have more JAK2 inhibition and may strike a better balance between JAK1 and JAK2 inhibition. So we're enrolling patients with higher risk myelofibrosis that have previously received a JAK inhibitor and enrolling them on this kind of two-part study with two different doses that we're looking at with plans to then escalate and expand these cohorts out a little bit. And really the hope is that we'll be able to provide effective disease control and symptom spleen improvement while not causing the same degree of anemia or thrombocytopenia that we see with these other FDA-approved agents. And so this is a study that's going to enroll internationally, some sites in the US as well as Europe as well, and we're really excited to see what happens.